suicide almost always involves a relational dynamic, and that people kill themselves because of the presence or absence of certain key relationships. And I am a big believer in Joiner's approach to looking at, that you have, and we've got data about this from the Mayo Clinic in the inpatients that we look at, you have this notion that some people don't want to kill themselves because they're worried about burdening other people. So they want to kill themselves, but they can't imagine what their mother would do or how they would sort of live with that legacy. And then, so we do see that as a reason for living. And then when we look at reasons for dying, we clearly see what Joiner describes as what is perceived burdensomeness, that it's almost like a fixed delusion that they really will be better off without me, and that I'm actually doing my loved ones a favor. And we see that consistently. And we really see sort of a tension point in some of our work where highly ambivalent suicidal people are really struggling between these sort of two poles, that I'll be hurting people that love me, or that I'll be doing this wonderful, giving them this gift, because they'll no longer have to worry about me. They'll no longer have to get these phone calls from the police. They no longer have to worry about my acting out and getting in trouble. And I've had clinically patients who are high in this perceived burdensomeness, really feel like they're, not only are they going to end their suffering, but they're going to deliver this gift to their family, and brought in family members in like a couples session or in a family session and saying, your husband here perceives that he's a burden, and if he killed himself, you'd be better off without him. And the wife, fortunately, not always, but fortunately saying, oh, no, that would be horrible. That would be the worst thing that you could do. And the husband saying, no, really, you will be better off. You may think that now, and sort of cling to it, sort of really persist and say, no, it's really, I know best. And not want to hear the discrepant information because they're in a place where this has really comforted them. That this is something I can do, it's going to help my loved ones, it's going to end my suffering. And that's pretty formidable, and that's very relational.